AIDS is a terrible disease that has had huge consequences on the globe. The fight against AIDS is ongoing and has effect everywhere. The disease had left some children orphans and destroyed families, leaving children with AIDS to fend for themselves while fighting this illness. AIDS had affected many people across the world. According to the USAID, there are 3.4 million children living under 15 with AIDS. This disease has affected many places, with the USAID focusing on providing aid to countries including Haiti, Nigeria, Cambodia, South Africa, and more. AIDS is an immunodeficiency syndrome, and it is the most severe stage of HIV, which is a virus that attacks cells that help the body fight infection, making a person more vulnerable to other infections and diseases. There currently is no cure. According to WebMD, kids with AIDS may lack caregivers, access to school, or the ability to stand up for their rights. Children can be infected through sexual abuse or rape. They may face bullying and discrimination unless other students and teachers understand how HIV is spread. According to HIV.gov, AIDS approximately affects 38 million people across the globe, with HIV and AIDS in 2019. Of these, 36.2 million were adults and 1.8 million were children. According to HIV.gov, AIDS is spread by contact with bodily fluids of a person with HIV, most commonly during unprotected sex or through sharing needles. This is a huge issue because of the lack of education. People could spread this disease without even knowing it. I was very surprised by the fact that so many kids are left without parents because of AIDS. It is heartbreaking that so many kids are subject to ridicule and becoming an outcast because of the lack of global education on AIDS. I hope we can spread awareness to this issue and bring it to the forefront of the conversation.
What has been done? The CUPS project that was funded by the U.S. President's Emergency Plan for AIDS Relief has given support and care for orphans in Nigeria in 11 of Nigeria's 36 states from October 2009 to October 2014. This is a huge project as Nigeria is struggling with support and the financial needs to keep their communities healthy. According to UNICEF, there is little to nothing that has been done to stop the spread of this deadly disease. Being a country where poverty takes place, it's important to educate these people and communities on the deadly effects of AIDS/HIV. Taking action, Project Hope is a well-known resource program that has been seen to help people of Nigeria in multiple aspects, including diseases, natural disasters, maternal health, and so much more. With combating the HIV/AIDS topic in orphans, Project Hope's key approaches include preventing new HIV infections, increasing detection, access to testing and counseling, improving quality of care, and basic support for people. The U.S. Embassy has set out a $19.2 million project that is set to provide much-needed HIV prevention, treatment, protection, and care and support services to the people of Nigeria communities. This project is estimated to take 5 years with hopes of providing more knowledge to these people. The effectiveness of these projects, each of these projects do a great job with spreading awareness of HIV/AIDS to the communities of Nigeria. The CUBS project does a good with intervention of spreading knowledge, while the U.S. Embassy project focuses more on funding of the overall help needed for people of Nigeria. The HOPE Project, they are a well-known agency combating HIV/AIDS with lots of intervention techniques and reach-out programs for people of Nigeria. The HOPE Project has been around for a while and uses resources for help. Limitations. While these projects are providing more knowledge to help these people in need, limitations of the CUBS project can be as they listed in the article of getting emotionally attached with the people they interact with, as well as not having more resources as they are in a limited environment, while the Embassy project is still developing on helping people of Nigeria. Even though the HOPE project is well known, there can be some limitations that come with this project. With that, they focus on specific populations and doesn't have a specific information of what they have done specifically to help stop the spread right now. Recommendations we think that will benefit as the projects that have been done and are continuing to go on right now. We think holding a GoFundMe account or a Venmo account where people can donate and possibly get medications that will help these kids that are in need. Another big thing is having more time to educate, as we think these projects are given a short duration to spread their knowledge to these people.
A social media marketing campaign can do a lot in trying to help the children with AIDS and to stop the spread. A campaign can educate people on the issue at hand and ways to help, including organizations to donate to. An example of a social media marketing campaign that we will do is a radio ad. This ad will consist of many basic information about AIDS and the orphans that are infected by them. This will air on local radio stations. Another example would be a TV ad. This would be very similar to the radio ad, except much longer and have visuals. This would also be a little more detailed. Both of these ads would contain information on how to donate to help these children in need. The last part of the campaign would be an educational poster. The poster will contain basic facts and visuals. The poster says AIDS is an immunodeficiency disease. About 38 million people worldwide are infected. It spreads through bodily fluids. There's no cure. Leads to abandonment of children. Donations can be made to SaveTheChildren.org, UNICEF, or many other organizations.